Do you feel that your hip is tight? Does it hurt to walk or pick something up off the floor, but you're a bit apprehensive to come see an osteopath? Then this video is for you. In this video, I'm going to demonstrate a general hip examination as well as treatment for the hip. Hi, I'm Jason, Associate Osteopath at Worthing Osteopathic and Wellbeing Clinic. Seeing an osteopath for the very first time can make some people feel a little bit anxious as they don't know what to expect. There will be many questions probably going through your mind at the moment, such as, what is an osteopath? How does an osteopath do what they do? And how can an osteopath possibly help? Hopefully this video will help to ease your mind as I'm going to go through a little bit of the demonstration of the hip treatment and examination. So during an osteopathic treatment, we'll firstly be taking your medical history. This allows us to understand what's going on and anything that might be making that pain a bit worse. It also allows us to think about the muscles, the ligaments, and joints around the hip that may be contributing to the overall hip pain presentation. We will then assess you. We'll do this by looking at the whole body. How does it move? Which movements cause pain? What type of pain is it? And in general, where is the pain? By doing the assessment, we're looking at all the different structures of the body that would be above it and below it as well. Sometimes these can be contributing to the different pain presentations as well. We then start treatment. There are 3 phases during our treatment. Phase 1 is to reduce the pain and inflammation. Inflammation is what tends to cause a lot of the pain in people, but inflammation is not inherently bad. In acute injuries, inflammation is bringing all those good nutrients into the area in order to allow the natural healing mechanism to occur. By doing manual therapy in this phase, we're able to help to desensitize the area, loosen off any tight muscles, and improve limited ranges of motion within the joint, allowing for that hip to move more freely. In phase 2, we start to work on building up strength around the hip. The stronger the muscles are in this area, the more force is able to go through it on a day-to-day basis. And then finally, we have phase 3. We work on activity-specific movements, whether that's getting ready to kick a football again or just climb up the steps. It really all just depends on your individual circumstance. Really, we just want to make sure that you're hitting your goals and getting back to normal life. Unfortunately though, not all of these phases can happen at once during the treatment process, and the amount of time is going to change depending on how long you've endured that pain for and what level of pain it is exactly. I'm now going to demonstrate on Gus a typical hip assessment as well as a treatment. Obviously, there are different types of treatment that I would carry out depending on what your particular problem is. However, this is a general glimpse into what you can expect by getting a bit of treatment from myself. So first off, I'm going to start by doing a passive assessment of your hip. I'm basically just going to bring your hip through the natural ranges of motion, and then if you feel any pain at any point, just make sure you let me know, okay? No pinch in the front of the hip?
Right.
That all feels pretty good, huh?
Feels fine.
Just going to put my hand on the front of your hip now, okay? Just let your leg drop out. That's pretty good as well, huh?
So good.
So overall, your hip just feels like it's a little bit restricted in terms of flexion and internal rotation. So I'm just going to work on trying to improve that motion by doing a bit of soft tissue work, circumduction, articulation, and traction for today, okay?
Sounds good.
How's that all feeling so far?
Yeah, feels good.
So next up, what I want to do is a muscle energy technique just for your hamstring, okay? So I'm going to get you to straighten your leg. And then just relax it onto my shoulder, okay? And I just want you to tell me when you start to feel tension in the back of your leg, okay?
Okay. A little bit there.
Perfect. So now just resist against my shoulder and hold that for 5 seconds, okay? Relax. How's this all feeling now?
Yeah, it feels good.
So I'm just going to start doing a little bit of cross-fiber soft tissue, and then we'll end up doing some inhibition or trigger point work into the front of your head. When I do the trigger point work though, it can be a little bit uncomfortable, so just let me know if it's ever too much and I'll make sure to ease off, okay?
Sure.
So I'm just going to press into the front of your hip now. I want you to lift your leg up, keep it at a 90. And after I press in, what I'm going to want you to do is just slide your heel down the plinth,
Sure.
okay? And go for it. How'd that feel?
It's slightly tender.
It's going to be a bit uncomfortable, but if it ever gets up above like a 3 out of 10, we'll ease off, okay? Now what I'll get you to do is just roll over onto your left shoulder. We're going to do a muscle energy technique to try and stretch out those hip flexors, okay? So I just want you to try and relax through your leg as much as you can. Now what I want you to do is pretend like you're kicking a football. And hold for 5, 4, 3, 2, 1, and relax. Now I just want to finish it off by doing a little bit of inhibition now into the glute. Is that okay with you? So I'm just going to find the tender point, and again, if it's ever too uncomfortable, just let me know. Perfect. So I'm going to let you stand up and see how that all feels now, okay? So what you can do is you can basically lift your knee up, and then bring it up, and back in, down, and that is it. Yeah, perfect.